Well, that was Kevin Hearn on immigration, but we also discussed healthcare, education, and gun control with Kendra Horn and Mark Wayne Mullen here at our OETA studios. Here's Jason Doyle's conversation with a lone Democrat representing Oklahoma in the U.S. House.
Congresswoman Horn, thank you very much for joining us. First of all, big news. A lot of the gun debate has flared up because of the recent mass shootings. Do you see any bipartisan solutions that can make it through a divided Congress right now?
Well, thank you for having me here today, Jason. It's really good to be here. I think there are some places that we can and we should continue to make some progress. These are issues that are incredibly important, and we know that gun violence is a problem across our country with mass shootings, but also gun deaths from domestic violence and other things. I think we've got to focus on common sense solutions that don't interfere with people's responsible gun owners' legal rights. And that means things like background checks, comprehensive background checks. We know that is one of the most effective ways to increase public safety, and things like red flag laws. Now, having said that, we've got to be smart about the way that we craft those. Because when we're talking about mental illness, we need to be wary of stigma. Not everyone that is living with mental health issues is a danger to themselves or others.
Well, you've recently introduced some new legislation geared toward higher education, the Slash Act. Tell me a little bit about that.
I talk to people every day, and right now we're facing a crisis in student loan debt in this country. There is $1.5 trillion in outstanding student loan debt across this nation. So I have introduced a few bills, Slash Act among them, to take sensible and reasonable steps to allow people to be able to get the job and skills training or degree that they need to go on to a bright future. This isn't about giving things away for free, and it's not about wiping everything out. What the Slash Act does is limit student loan interest rates. Right now, we've got student loan companies that can charge and are charging over 10% interest. This simply ties the student loan interest rates to the 10-year bond rate. So they can cover costs, but we're not asking our young people to mortgage their future just to have one.
You are also working with a team of representatives on the Better Service to Borrowers Act. Tell us a little bit about that one.
Yeah. So when we've got people that are taking out student loans, they understand how much the original loan is, what the interest is going to look like, how much they will end up paying, and what it looks like if they do different things. And it would propose a uniform system so that when you got a financial aid package from one college, it would look the same as the other, and make it easy to read. And there's a couple other pieces of legislation that we've been working on. I've also introduced the GRACE Act, which would reinstate the grace period. Used to be when students took out loans for college or career tech or any other higher ed, they didn't accrue interest until 6 months after they graduated or stopped taking classes. That's no longer the case. That means that we've got students accruing tens of thousands of dollars in additional interest before they even graduate. And I've also co-sponsored a bill that would allow student loan debt to be dischargeable in bankruptcy. It is the only kind of debt that is not dischargeable in bankruptcy right now. So these are just things that leveling the playing field, sensible solutions that give people pathways.
A wider issue, healthcare and health issues. One of the focuses that I know you've been working on and other Congress has been working on are prescription drug prices. What's being done to help put that pressure downward on the prices so it's more affordable?
Yeah. We did, and I think you were there, a town hall on insulin pricing. We have seen the cost of these critical life-saving drugs increase thousands of %. What we don't know is the why. We've got to make sure that these companies can continue to investigate and explore new and life-saving treatments, but not at the expense of people having to choose between putting food on their table and the life-saving medication they need.
Congresswoman Horn, thank you so much for joining us today.
Thank you so much, Jason. Really glad to be here. Appreciate it.